Hello, YouTube. Wow. Okay. Hello, YouTube. Welcome back to my channel. This is Naquana B TV. I'm Naquana B. To all my new viewers and subscribers, welcome to my channel. And to all my seasoned viewers and subscribers, thank you guys so much for coming back. It's been a while, and I'm so sorry, but your girl has been really busy and stressed out. But I have a really special video today planned, and hopefully it goes the way that I need it to go, okay? So today is gonna be my second vlog because I really liked my first one. I will be filming a day in the life of a pre-med student. I have a couple things that I have to do today. I woke up this early. I should have woke up earlier because I have some things that I want to finish. Like I want to try to do an assignment, finish it by around 11:30 or so. I want to do laundry because, and I want to do all this early because I'm shadowing today. Today is going to be such a special video, hopefully, and I already know that I'm probably not going to be able to record a lot in the hospital, so I'm not even going to try to before they, get upset and try to kick me out or something. But I will definitely be updating you guys and telling you what I saw, of course, being mindful of HIPAA, okay? And if you don't know what that is, just Google it. I'm not gonna explain. Okay, so without further ado, let's get this show on the road. I'm going to take a shower, get some food, start my work, and start my day, okay? So continue watching for the rest of this vlog, please. Okay, guys? Thank you. Okay, so I'm in my laundry room. I'm about to get my laundry started. I look crazy, but nobody's awake, so it's okay. Oh, I just spilled the whole thing. That's about right. Yep. I wouldn't be Naquana if that didn't happen. This is what I get for trying to be fancy and using that thing when I know I always spill it. Let me just... Okay. First of all, I definitely forgot my fabric softener. So honestly, right now, everything's going left. Which one is... I can't find which one is to wash. Okay. I swear I know how to do my laundry, guys. I do. Let me turn this off. This is embarrassing. Okay, so I'm running back to my room to get my fabric softener and some paper towels because I gotta clean that up. Instead of washing my clothes, I'm washing the machine. Okay, I did it. And I got my softener. Okay, so now I'm going downstairs to get some food because I'm hungry. So I'm back in my room now because apparently the dining halls don't open yet. Isn't that lovely? I've been in this school for 3 years and I still don't know what time the dining halls open on Sundays. Amazing. That's just so upsetting. Like I went down there fully ready, like, oh my gosh, it's early, I'm about to get some food, and it's closed. But I'm gonna go, I honestly forgot that I was doing laundry. So I'm gonna go check on my clothes. I'm pretty sure that when I go over there, it'll be time to put them in the dryer. So I'm just gonna bring my dryer sheets with me. My snuggle. Is that it? Snuggle? Yeah. So my clothes are done. What the hell is this? So people are supposed to clean out the lint trays, but no one ever does. And like I cleaned it out before because I don't want nobody else lint on my clothes. And this is disgusting. Like I don't know what they washed in here, but they need to do better. It is 10 o'clock. Well, 10:03. I have my laundry in the dryer. That'll be done by like 11. And I'm gonna get started on doing the assignment that I said I wanted to do. Right now, I'm about to make some coffee. This is my kettle. It has a little plug-in pad here. It goes like this. And it boils my water, clearly. Of course I spilled it. Of course I did. Y'all are probably wondering what is going on with my screen. So I'm taking this art history class, which I regret, but I needed it for an elective, an arts elective, whatever. And they got me watching something in regards to visual music. So I'm here not knowing anything about the art, thinking that I was about to hear sound for once in this class, because all of our movies or videos or films that we've been watching have been silent films. But no, I'm watching a bunch of boxes fly across my screen, and now I have to make a response. Love it here. This is my professor, and I'm not about to watch this whole lecture, but we're gonna see what he's trying to say. Okay, so I watched my lecture, took some notes, and now I kind of get what I was watching earlier. So now I just have to go ahead and like write a response on it, and then I have to respond to 2 other people. Hopefully I can be done in a decent time. We shall see. I think my response has to be like 250 words, which is really nothing. So I should be done. I should. So I'm finished with my assignment, and it is 11:10. I'm going to change my clothes and get ready to go to the hospital. And on my way down, I'll stop and get some food because I'm gonna be there for a while, and I don't want to be starving. So I'm gonna go downstairs and get some food. Running a little late because of the fact that the dining hall was not opened the time that I thought it was gonna be. So. Okay, so I picked up my laundry, as you can see, it's right there. And I'm going to unpack that later. I'm supposed to be at the hospital around 12. Like, it's really just like whenever I want to come in, because she just told me when her shift is. And she told me it was 7 a.m. to 7 p.m. And clearly I wasn't gonna get there at no 7 a.m. So I told her that I would be there around 12. But right now it's looking like 12:15. But it's okay. I'm gonna go down and get something really small to eat quickly, change my clothes, and then head out. And yeah. I got my food. Of course, the day that I'm running late is when everyone wants to be in the dining hall. So the line was exceptionally long. But we're making our way. I am changed and I'm ready to go. I have on sneakers because she told me that she'd be giving me scrubs when I got in. Hopefully I told her the right size, because honestly I don't know, because I wear different sizes depending on if the scrubs are unisex or not. So we're gonna hope they fit me, but I still wanted to look presentable. So I bought this shirt so that it could cover my butt, because you know, gotta be professional. And sometimes, you know, like I can't have that. So I wanted it to cover my butt. And I don't know, it's cute. I kind of look like, I don't know, Mary Poppins, but it's all right. It's okay. I look like a little schoolgirl, a librarian. I don't know. Okay, so since I'm going to the hospital, I'm going to be wearing 2 masks. You know, extra protection. So I'm gonna wear one of these, and then I'm gonna put what's it called, KN95 over it. But I'll put that on like when I'm outside of the hospital, because I'd like to breathe on my way going to it. So right now I'm just gonna put this one on, and then yeah, I'm also gonna carry that pack in my bag just in case anything was to like, if any of these like burst, whatever. Got this one right here with me. Looks like a little handbag. Anyways, yeah, I'm gonna pack a bag real quick, and then I'm gonna head out. Okay, so I'm outside, going to my car now. I really hope I didn't leave anything. I have my bag packed, and I'm going to my car. Okay, so I don't remember where I parked, but we're gonna find it. The hospital is not far from here, so that's a good thing, because it is 11:40 now. So about 20 minutes to just get there, park, and get inside. For some details, I'm shadowing a OBGYN today. I've only ever shadowed before a CNA and a emergency medicine doctor. So this is a new department that I don't really know what I expect to see today. But yeah, in my bag that I have packed, I packed a notebook, which is what I use to document my shadowing experiences, because I need a certain amount of hours. So that helps me to just keep track, and I take notes about the specific doctor and everything that happened, about the patients, clearly not putting names and all that stuff because of HIPAA. And yeah, I'm in my car now and I'm gonna head off. I know myself so well. Like last night I went and I drove out and got some gas, so I just knew I was gonna be running late today. It's kind of cold outside, but luckily I packed a sweater. I don't know who I thought I was, only wearing this, but whatever. It's not that far of a walk from where I parked to the inside of the hospital, so. Okay, so I just parked, and I am walking to the hospital. It's not that far from where I am. I think it's called a wind tunnel. I don't know, some crap like that. But this little ramp right here, I go through it and go up the steps, and then I enter in through our health sciences building, and then just go over to where the hospital is. Kind of proud of myself. I'm not doing too bad on time. It's only 11:48. By the time I get to where she wants me to meet her, it'll be 12. So I did good. So as you can see, I'm in the little tunnel now. I got my food with me because she told me to bring something because it's gonna be a long day. But yeah, she also told me to bring a book just in case the day is kind of slow. But I kind of forgot. But it's okay. Just gives me more reason to find things to talk about. You know, got a network. But yeah. Whew. That little ramp does a number on these knees, man. I'm getting old. So this is our health sciences building. That's usually where I go to the library to study. And then it's connected to the hospital, which is like over there. Okay, now I'm in the hospital. Kind of. Still kind of. It technically is. But I'm going to go around and she told me to meet her at Starbucks. So that's when I'll call her, and that's probably when I'll stop recording. And then after I'm done, I'll just be giving you guys updates. I'm going the wrong way to this way. But yeah, I'll be giving you guys updates when I can, and I'll probably show you guys when I change into my scrubs, and then later tonight when I leave, because I think I'm leaving around 5 or 7, is when I'll tell you guys how my day went. So I'm excited. Yay! I just put on my KN95 because I'm in the hospital now, and I am waiting for her to meet me. So I just got my scrubs on. They're a little big, which I expected. Here's the top. It says Stony Brook Medicine on it. Is that a flash forward? Hint, hint. Maybe. I got my little tag on it, and I just dropped my little tag. Amazing. That cannot happen today. She was making sure that I ate because she said that a lot of people who have shadowed her had fainted, and she's just like, just make sure you ate something. So it's really good that I went and got breakfast, because I was really gonna risk it all and just come, and that would have been really bad, because knowing myself, I'd be the one to faint. So this is usually how I document. I kind of just go throughout the day and say what I saw, as well as some details on the person that I was shadowing, which I'm not really gonna share because that's personal. But yeah, and then I dated and stuff. This was from my first shadowing experience. As you can see, everything just smudged up. So I ran away to the bathroom. She gave me goggles and this cap because we went to a sterile area. She said that she has a C-section today, and she's gonna ask them if they're okay with me observing. So if they are, I'm gonna get to see a C-section. But if they're not, that'll be kind of sad. But it's okay. It's okay, because I'm just really so happy to just be here. But yeah. So I didn't get to go to see the C-section, and I'm not sad or anything, because honestly, if it was me, I wouldn't want some random student watching me create life in the operating room either. So that's fine, but I'm having a lot of fun. I'm learning a lot of different medical terminologies and different instruments that are used for certain things. But yeah, I guess that's the update for right now. Learning more about the doctor that I'm shadowing. But right now she's in the OR. She's doing the C-section, so I'm waiting for her to come back. And yeah, so I am back in the bathroom, clearly. Like I said, I think in my last update, I wasn't able to go into the C-section, which again, I understand, because I wouldn't want any random student in my C-section either. But I am going to be able to watch a delivery today. That's really only if the mom does deliver today. So I went in, I introduced myself to her and everything. However, she didn't speak English, so like they have like this phone and the interpreter was on the phone. So I basically spoke to the interpreter, and then the interpreter told her what I said. So that was pretty cool, because I didn't know that the interpreters were like over the phone. I thought it was like a physical person like that was there. But that was cool. Right now we're just waiting for her cervix to thin. They placed this specific instrument to help with that, and then like turned her on her side because sometimes that helps. So we're really just waiting. So I'm really excited, and I'm here until most likely 6:30, 7 o'clock. So hopefully she is going to be in active labor by then, and of course I hope that's a, you know, good delivery and all that stuff too. It's now like 2:30, I think, almost 3 o'clock. So we should see. We shall see. Yeah, we will see. Yo, I'm a joke. But yeah, that's my update for right now. So stay tuned. So I am leaving now. I'm changing my clothes. And guys, I have so much to tell you guys. I watched 2 deliveries. It was only supposed to be 1. And that's the one that I was explaining earlier. And then someone else had a delivery, So I got to see both, and it was just so cool to see the differences between the deliveries. And thankfully, both deliveries went smoothly, and then the babies are fine, and the moms are fine, and guys, clearly I'm hyped up, but I'll tell you guys more in a minute after I change out of these clothes. It is so cold out here. I just left. I have my sweater on. Thankfully, I even brought this because I'm thinking about if I didn't have this and I was walking back, I would be an icicle at this point. But I had such a good time. I really got to pee, so I'm like speed walking to my car right now. And when I get in, I'm just gonna fill you guys in on everything that I experienced and saw today. Real generalized, of course. And yeah, like it was literally so slow the entire day. It was so slow, and I'm just like, why don't you just be patient? Because like it's not something you can rush, clearly. Even though sometimes I'm just like, can somebody have this baby right now? But eventually towards the end, like like the saying that they say, when it rains it pours, that's what we experienced tonight. Like literally, it was like not even 20 minutes before her shift ended. That's when all the people that we've been monitoring all day was just starting pushing and stuff. So definitely great. I don't know, just got that man in my camera. It was great, and she also explained to me what happened while she was gone, because I think I told you guys earlier that the doctor I was shadowing had gone to perform a C-section, and stuff happened there too. Like, I gotcha when I get inside though, because my hands are freezing. Okay guys, so I am about to update you. I'm clearly just like on a high from everything that I experienced today. I'll just go through the whole day, you know. First of all, the first part, like I was just so giddy, because just like I've never experienced this before. Like, oh my goodness. So I walked in, you know, we got our scrubs, and it was like a machine. So they had a machine, and you know, she swiped her card, and that's what the scrubs was in. We got the scrubs, I changed, blah blah blah, put the cap on, and I had the goggles because we were going into sterile places, and that was really cool. The first part of the day, you know, I was kind of just sitting at the desk with some residents and a med student and stuff like that, and we were just talking, and they were explaining a lot of things to me. They explained different codes. I learned more about the monitors, like the central monitoring. So basically there's a bunch of different monitors around the vicinity that just show the fetal heart rate as well as the contractions that the mother's having. So that was pretty cool. They taught me how to read it. Clearly like a generalized aspect of reading it. Of course I don't know what everything on that screen was saying, but after a while I kind of knew like what meant, you know, urgent and what was just normal. Like a fetal heart rate, like the normal fetal heart rate, they said is like between 110 and 160. So when I saw anything drop severely low or severely high, it was just like I just monitored and watched and observed how everyone talked about that and how they responded to it. We talked about midwives and the difference between midwives and doulas, and we talked about how a midwife is more of a practitioner, while a doula is more of a labor coach in a sense, where midwives do kind of everything that like a gynecologist would do, but their premise is low risk labor and delivery. So anything high risk, that's when they would consult with the OB-GYN and they'd come in with the patient and stuff like that. We talked about epidurals. I always knew what an epidural was and why it was used, but I never knew like the risks of it. So we talked about an epidural. So That just allows the patient not to feel anything other than like they'll feel like pressure and stuff like that, but not the pain. And it's like a catheter that's like in the back, so like it's in your spine. I'm pretty sure it's connected to your spine, and it's like a catheter or a IV1 if you want to say that, and it just has like constant medication being pushed through in it, and they can up the dose and stuff like that. We talked about anesthesiologists and their importance. We talked about C-sections in terms of when the patient is awake and alert, and how the anesthesiologist basically keeps the patient alive while they're doing their thing. Like I said, I didn't get to watch the C-section, but after she came out, she explained a lot of what was happening to me. Of what was happening to me. Like, she explained it to me, not to me. Anyways, and that was really cool to learn about. I learned about meconium, which is baby poop, and the color is usually green and black, or black. And basically what had happened in the surgery, which made it kind of complicated, there was a complication, was that the meconium was in the pelvic area, which raised concern because it's supposed to be in the uterus. So it's just like, how is it coming from the uterus into the pelvic area? And that's when they realized, the uterus had ruptured and all this stuff. There was a defect, to the point where she was saying that she didn't even have to use like a knife or whatever to cut the uterus open. She literally just unzipped it with her finger. So they talked about that and why that may have happened. So it was like they caught it right on time. Like as soon as they got into the OR, that's when it had ruptured. So it was just like, so they were like, she was so lucky that they were there and at that moment of time to just work through it and all that stuff. So that was pretty cool. We talked a lot about postpartum hemorrhage because that is what happened in the surgery, as well as what happened later on. So that was talked about heavily. We talked about residency, we talked about med school, we talked about pros and cons of different fields of medicine, and it was just an amazing experience. Now to the fun stuff. I got to watch two labors, two deliveries? Two labors? Why did I say two labors? I got to watch two deliveries, and I did not expect that. Like, it was just so amazing. First of all, I've never seen so much blood in my life, and I thought that I was gonna be fazed by it. I thought that I was gonna possibly just faint, and I'm just like, yo, that would be mad embarrassing, because never did they allow me in here, and I'm over here ruining the moment, fainting. So I'm so glad I didn't. And when I say blood, it was a lot. It was also fascinating to see like the differences between patients. So the first patient, both patients were, this wasn't their first rodeo. They knew what they came to do, they knew how to do it, and they got it done. But the first patient was definitely much more smoother, because the second patient, she had spiked a fever, and there was an infection and all these stuff. So the first patient, they pushed and everything, and the baby came out crying, all that stuff, and it was just so amazing. I was just like, yo, this is phenomenal. Like, when I tell you, and I just love to see how all the different workers worked as a unit. Like, they were all one, and how it was like kind of a choir. Like, they were all just chanting her on and rooting her on. Both patients were like, English wasn't their first language, so there was an interpreter, and I'll get more into that soon. But it was just so amazing. And now I'll talk about the second one briefly and generally. Like I said, fever, infection, so it wasn't as smooth as baby's out, cut the umbilical cord, give you the baby. It was definitely more, let's go check if the baby's okay because there was an infection, let's incubate the baby, all that stuff. I watched as the father cut the umbilical cord. It was so funny because he was just like not looking the entire time. Like, he was not about to look down there, but he was just like, yes, I'm about to cut this cord. So he did his thing. Then like they had to inject her leg and insert medication into her body through her anus. to help her stop the bleeding, because she was bleeding so much. And you know, that's when like I said, we talked about postpartum hemorrhaging, and that's what was occurring. So eventually, you know, the bleeding came down to a minimal, and it was just like, wow, like that's just crazy that, you know, someone can even lose that much blood and be okay after that. So thank God that they're both okay. So I watched as, you know, that they had the med student insert the medicine into her anus, and it was just so cool. I love to see like how they worked with the sterile environment. They had these little gloves that were like, there were sterile gloves, and they were in like these baggies which were like made out of paper. So it's just like they opened it up, they put their hands on it, and then they put their hands in them, and it was just like, don't touch me, I'm sterile. Like that's exactly how it felt. So I was just there with my hand behind my back because I didn't want to touch nothing. Like, y'all not about to have me contaminate nothing, okay? So I was just sitting to the side poking, and then the doctor, she's just like, girl, come over here, come look. And I'm just like on my tippy toes watching, and it's just like all the blood, watching them pull out the placenta. And it was just like amazing. Like when I say that I was amazed, I was just sitting there like, what? We can do that? I'm just like, damn, that must hurt. I just feel so blessed to even have had that experience. What else stood out? That birth was definitely just much different because of how the different factors that occurred. And you know, it was a higher risk labor because of the fever, because of the infection. There was like post delivery meconium. I don't even remember the word, but it was the baby's poop definitely was just gushing out with the baby when the baby was pulled out. But it was just so like amazing, like seeing when they were crowning and watching as the baby's head just popped out, and then them pulling the baby down and up and down and up to get him out or her out, and then the baby crying. It was just like in that moment when the baby comes out, it's just like so like enticing, because now it's just like cry, you gotta cry, please cry. And you know, hearing the baby cry was just like, okay. It was so cool because they gave me the phone, so I was just there running around to each person who was trying to speak to her, you know, putting the phone to their mouth, and you know, they spoke to the interpreter, and then I'd go back to the bedside and I'd give put it near the patient's ear, and then the interpreter would clearly interpret. And you know, it was cool how smoothly it went, even though like there was a language barrier. Then eventually the staff knew what the interpreter was saying, so like to say the word push, and you know, telling the parents congratulations and all these stuff, you know, it became common, so they would all just tune in and say it. And it was just like a choir, like everyone just rooting for her, and it was just amazing. So if I was supposed to compare and contrast the places that I've shadowed in, I've only shadowed in emergency medicine and now OB-GYN. So I would say that similarities are that they're both very fast-paced. It's just constant, on the go, everything. They both see a wide range of patients and a wide range of different things in a day, which I didn't really know about for OB-GYN, because it's just like when you hear about OB-GYN, at least for me, all I thought about was gynecology. So all I'm thinking is vaginas all day, pass. But now it's just like that surgical aspect, the aspect of these different things happening to these pregnant women during their pregnancies and all that stuff. So that was really cool. The fact that the days are never the same, that's definitely something that I value and that I really want in a career, because I get bored really easily. Like I can't be nowhere where it's just like I'm bored every day. Like I have to be on my feet all the time. So these are specialties that I definitely will consider, but I do have a really open mind because I know I can't just be hell-bent on one specialty. Like my mind's gonna change. First of all, I'm already indecisive, so it's just like, girl, don't even try it. Don't play yourself. But that's really cool. If I was supposed to say differences, is that one big difference, which I also hold as a con for emergency medicine, is that continuity of care. When I shadowed in emergency medicine, although I loved everything about it, I really was sad that there was no continuity of care. It's just like at the end of the day, I was talking to the doctor I was shadowing, and I'm just like, what happened to this patient? What happened to that patient? What about this, that? And he's just like, oh, that one got admitted, that one left, this one was sent to this place. And it's just like, damn, we don't get to see them again. And he's just like, nah, that's it. And it's just like, wow. Although I loved it, I loved that, you know, that idea of going in, getting the signs, the symptoms, the patient history, putting it all together, looking at labs and figuring out who to call and what they need. I loved that, but I didn't like that I couldn't follow up with the patient. I don't know really what happens with them after, and I'm not the person that, you know, brings them through with that. So that's definitely a difference between the two, and that's why I would say that right now OB-GYN is in the lead. If I was supposed to put them at a race, I think OB-GYN is in the lead. Another con would be the flexibility of shifts. So emergency medicine is definitely more flexible than OB-GYN is, because they have like a kind of day shift, night shift type thing, where it's just like, if you do the 8 to 5 Monday, and then Tuesday you have the noon to midnight, it's just like you have that gap between 5 p.m. the day before and then 12 the next day to just, you know, be to yourself. Whereas OB-GYN, I think all their shifts are like 12 hours, you know, back to back to back, I think. But that's more information that I'll get. And you definitely have more time to breathe and be home and, you know, do your own thing. What's another difference? The burnout rate, there we go. Emergency medicine has a higher burnout rate than OB-GYN. So that's something that's also concerning, because it's just like they're under so much stress, because you have to know so much as an emergency medicine doctor. You literally have to know a little bit of everything, which is why I loved it, but it's also concerning because it's just like that can take a toll on some people. So I definitely understand that. But overall, like I said, OB-GYN is in the lead right now, and I'll be shadowing more with that specific doctor, as long as we can, you know, create a schedule and stuff. But I think this is going to be the end of this vlog for today. I really hope you guys enjoyed this video. I hope you guys learned a lot from it and are inspired and want to continue, because I know that there's been specific videos that have encouraged me and made me just, you know, want to experience that, and that's what pushes me and motivates me to go on. So to all my pre-med babies and my pre-med babies, I hope you guys love this video, and I hope it inspires you to go on. This is the end of this vlog. Thank you guys so much for watching. Remember to like, comment, share, and subscribe. I will see you guys in my next video. Naquana out.